there, I'm your host, Sarah Lorenzini, a rapid response nurse and educator who loves telling stories to teach critical thinking. This podcast is for nurses who want the knowledge, skills, and confidence to respond to any emergency. With almost 20 years of experience in the ER and critical care nursing and a master's degree in nursing education, I have a lot of stories to share, and I love to nerd out and break down the pathophysiology, pharmacology, and nurses' role in emergencies. Stories bring learning to life. It is way easier to learn from and remember the stories that my colleagues and mentors have told me than anything I've read in a textbook. And that is why I made this podcast. Every episode is packed full of exactly what you need to know to handle whatever crisis that could arise on your shift. It's one thing to get the right answer on the test, but knowing how to detect when your patient is declining and what to do when your patient is crashing is what will make or break your day and might just save your patient's life. Hey guys, so I just came back from NTI, which is a national nursing conference for critical care nurses. It was amazing, and I got to meet literally thousands of nurses from across the country. One special thing I got to do was interview a lot of you, the listeners. So during day 2 and 3 of the conference, there's a huge expo of which I had one of the booths. And as people would come up, I'd ask them, would you like to be on my podcast? If so, I'd love for you to answer the question, what's your most heartwarming nursing story? What's your craziest nursing story? What's a moment in nursing you'll never forget? When's a moment where you felt very proud to be a nurse? And it was just really cool to hear from you what your experiences are, again, from across the country in nursing. So for this episode, I've compiled all of those stories together to make one beautiful story that reflects nursing today. So sit back and relax and enjoy this NTI 2024 recap. All right, so Cameron, welcome to the Rapid Response Nurse Podcast.
Thank you.
First, tell me, what kind of nurse are you, and how long have you been a nurse?
I'm an ICU nurse in the medical ICU, and I'm almost at 2 years in September.
That's awesome. And you're precepting?
I'm precepting.
Okay. What I want to hear today is, what will you always remember as a nurse? Like something that's really special to you.
Something happened pretty recently, a couple weeks ago. I was precepting a new grad nurse for 2 days, 1 week, and then I picked up a few shifts the next week. So I ended up having a total of 7 shifts with this patient. So I was very familiar with the family and the patient, and then I ended up being off for 3 days, having to go to emergency surgery, going to cardiac arrest, and passing away. And so I was very upset about it, just because I was so familiar with them.
7 shifts. That's a long time to bond with the patient and their family. Yeah.
So I was upset that I just didn't get to resolve anything or say goodbye. But the wife of the patient actually came up a few days later to the unit and gave me a card and hugged me and just thanked me. So
that is awesome.
That just meant the world to me.
It does, and that's why we do it, right? It's because we get to impact not just the patient, but like the family's memory of a really hard experience.
Yeah, it's
an awesome heartwarming story.
Touching people, touching patients and people's lives. It's what I do. It's why I do it.
Love it. So the next person I got to interview was such a privilege because I actually got to teach her as a nursing student back from my nursing professor days. And now, 7 or 8 years later, she's back in school again, getting her CNS, working in ICU, making an impact on the profession. It was so good to reconnect with her and see her just thriving as a nurse. I can't wait for you to hear Shannon's story. Hi, Shannon.
Yes.
Welcome to the Rapid Response Nurse Podcast.
Thank you.
Before we dive into this story, can you just tell my listeners who you are, what kind of nurse you've been doing, and how we know each other?
Yes. So I am Shannon Patrick. I have been a nurse now for 8 years. I started 5 years in the CV ICU, and then I went travel nursing up to Atlanta, and then I became a staff nurse, and then I transitioned to rapid response nurse, and now I have just transitioned to a CNS for critical care for the system. What is amazing is Sarah was my nursing school professor when I got my associates in nursing in 2017. So that's how I know Sarah.
Crazy it's been that long.
I know.
That's crazy. Okay. So what we're talking about for this episode, this little mini episode, is I want you to tell me your most heartwarming nursing story from your 8 awesome years at the bedside.
Well, I've had a lot of experiences in all of that time, but most recently when I transitioned to the role of rapid response, I was kind of exposed to all different kinds of situations in the hospital. You never know what you're going to get, and that was really scary for me to start with. But anyway, I got called to see a mom after a C-section.
Oh my gosh.
She was tachycardic.
That's not the call you want to get.
She was hypotensive. We didn't really know what was going on. And when we get calls from those nurses, it's often like very frantic. They're not used to acute patient changes. And so they really rely on us a lot. And also the physicians there rely on us a lot. So we got there. She didn't have any of the like classic signs of postpartum hemorrhage. She wasn't like vaginally bleeding. She was kind of groggy, she just didn't look good. Didn't have a fever, so we weren't thinking sepsis. It was really like kind of a question. So physician went ahead and had us start giving blood, just ordered 2 units just to try and stabilize her blood pressure and her heart rate. And I was pressure bagging this blood on, and the patient would stabilize when the blood was infusing, but then as soon as the blood stopped, her blood pressure would drop again. Her level of consciousness would decrease. It was just like we couldn't sustain, but the OB kept coming to bedside. She was like, well, she's not bleeding vaginally. Like, I don't know what's happening. She's not bleeding. So ultimately, after 5 units of blood in the post-procedural area, I talked to the doctor and I was like, doctor, I think she needs to go back to the OR. Like, I know we're not seeing vaginal bleeding. She had done an ultrasound at bedside. She's like, there's nothing in there. The physician didn't want to take her back to the OR, so she wanted her to go to the ICU. We took her to the ICU, and on our trip to the ICU, the doctor changed her mind, decided, okay, maybe I should take this patient back. Turns out she had a retroperitoneal bleed.
Really?
Yes, and she was actually bleeding internally, so that's why she wasn't vaginally bleeding. She wasn't having any. But anyway, I stayed with this mom and her husband, the dad, for many, many hours trying to get her stabilized. Dad was so empathetic and like wanted us to save her. Obviously, but he knew something was wrong with his wife. Anyway, she went back to the OR. The next day I went to see her. She was awake. She was alert. She was perky. She got to see her baby. Her husband was relieved, but it was so scary being there because we couldn't really pinpoint what was going on, but she made a full recovery. I mean, she went from critically super sick to stable within a 24-hour period. And it just warmed my heart because the moms are really hard. It's really hard to know that like a mom might not do well.
Yes. But also what a privilege to know that you are a part of their story. Their really scary journey, you got to be there for them.
Right.
You got to be their nursing experience.
It was her husband. I'll never forget how appreciative he was the next day, but also like how no matter what was happening in the room, like he just kept looking to me, like very sentimental to me that he really trusted, my expertise, even though he didn't understand the dynamic or anything like that, but he just kept looking to me as though like
that source of hope.
Yeah,
guidance.
exactly.
Like, how bad is this?
Yes, yeah. So it was really wonderful.
Shannon, that's an awesome story. What a great recovery. I'm so glad you got to be there.
Yes.
I'm so glad for the family that Shannon got to be the nurse on that experience.
Well, it wouldn't be if I didn't learn from you all those years ago. So,
Shannon, thanks so much for sharing.
Of course, thank you.
So proud of you.
Thank you.
Don't you just love that? This next story is another story of a patient that recovered surprisingly, and Cassandra got to be a part of that recovery, and she'll never forget it.
My name is Cassandra Gauss, and I'm a medical surgical ICU nurse.
Awesome.
Something that I think back to is just a patient that I had throughout COVID, where she went through a lot, as most of our patients did, and ultimately she survived after being in the hospital for 100+ days.
100+ days?
Yes. And I think her trach was removed before she got back home.
That's a win.
Yes. Yeah, she's a friend now.
Really?
And sends me encouraging messages on Facebook.
Really?
Yeah. And it's kind of, it's one of those moments where you're like, oh yeah, we do make a difference.
We do.
Yeah.
You got to be a part of her story, her 100-day hospitalization. You got to be there caring for her in that time.
So
yeah, those are the moments where you're like, yeah, dude, I'm proud of the work we do.
Yeah.
This is awesome. What you get to be a part of. I know it was hard caring for the same person for so long and the emotional weight of that. But man, what a privilege.
Yeah,
I love that story.
It is a privilege.
You should be proud. You should be proud of that story.
And she reminds us, you guys were the reason why. Yeah.
Why she's still here.
Yeah.
Awesome. I love it.
Yeah.
So this next nurse that I got to interview is Melanie, who I've actually known for about a year digitally, messaging back and forth clinical questions and kind of and going down deep rabbit holes to understand challenging clinical concepts and how to apply them to practice. It was so great to meet her in person finally. We share the same strength and weakness of maybe sometimes overanalyzing clinical presentations and thinking worst case scenario. But again, can be good or bad. Stay tuned for Melanie's story.
I work at a somewhat rural hospital, medical surgical ICU. We actually serve quite a big county for the size of our hospital, so we always have quite a high census and a lot of variable acuity, so it keeps it interesting.
Yeah, interesting is a great adjective. I love it. So tell me about a patient care experience which is very memorable for you as a nurse.
Yeah, so I was pretty new at the time. I've only been a nurse for about a year and a half, and this case took place about 7 or 8 months ago.
Okay.
I have a real tendency to assume everything is my fault. Comes from my EMS background, I think, a little bit.
Yeah.
But I was taking care of this woman who had come in with a GI bleed. She had gotten a couple of clips, and she had been intubated for airway protection. When I took care of her, she had just been extubated that day, the first time I took care of her. And that night, she had a strong history of anxiety, so she was very anxious all night. We were giving her like anti-anxiety meds, and she was calming down, and everything was mostly fine. And then I took care of her the next night, and she started getting anxious again, but it was a little bit different. And I was like, well, her heart rate's a little bit higher this time, and her skin signs are a little bit off this time, and she just seems not just anxious.
Right, yeah.
So I started running through like all my shock differentials. I was like, okay, well, I don't see any signs of bleeding. Heart function is fine, was fine before. Her entry EKG was fine. She didn't look dry or anything like that.
That's some good critical thinking for a new nurse, going through all the different shock things. That's awesome.
Thank you.
Okay.
And then it occurred to me, I've seen as a paramedic, I saw people with pulmonary embolism, and their most primary presenting symptom was tachycardia and anxiety.
And anxiety.
Yeah. And so I was like, oh my gosh, it's a PE. And then I thought to myself, oh my gosh, I don't think I put the SCDs on her last night.
That's what did it.
It must be my fault. It was the SCDs. Now it's a PE, and it's my fault, and she's going to die. And I'm freaking out. And so I'm doing all the things, right? Like I'm trying to like, okay, is it really PE? All I can really do without a bunch of orders is an EKG. And so I go do an EKG, look for right heart strain.
Good thinking.
Thank you. I didn't see anything like that.
Good.
I'm asking her if she's short of breath. She's not really like, she's like, I just feel anxious. I just feel off. Her stats are okay, but they're starting to dip a little bit. And so this is more like leaning into that might be a PE kind of thing. I talked to a bunch of, my teammates. I have a really great team at my hospital, which is wonderful. And as I'm like freaking out, I'm like totally convinced it's a PE. She starts throwing up blood. And like lots of blood.
So that might be the source then.
And I'm still like, I'm looking at it and I'm like, it still could be a PE on top of this though, right? Like it must still be my fault. Anyway, it was not a PE. It was just a GI bleed.
Just a GI bleed. That is enough to make you anxious and tachycardic.
Yes,
so it wasn't
absolutely.
Your STDs.
It was not the STDs, but I am very, very adamant about STDs now. I will tell you that.
I love this story. I had a patient, cardiac arrest, and my first thought was, oh my gosh, I thought that was Zofran I gave them. What if it wasn't Zofran? What if it was something else that starts with Z that killed him? But of course, I'm like literally digging in the trash can.
Yeah.
Like, did I kill it?
Yeah.
No, they were like including tamponade.
Oh my gosh.
But I was like, but what if it wasn't?
Like, I pushed the Zofran too fast and they had a long QT and I didn't notice. And
right. That's exactly my thought process. Like all the worst case scenarios that I know about, like, am I the cause? No, I was not. And most of the time, I would say like almost 100%, it's not the nurse. Yeah. But I think it's good that your critical thinking was like, could it have been though? It's worth considering.
Yeah.
I love that story. Thank you so much for sharing.
Yeah, thanks for having me on.
This next story comes from Maddi, who's a nurse I've been following for a while on Instagram. It was great to finally meet her in person. She's going to tell us all about an absolutely crazy shift she had, that she thought it was over when her shift ended. But no, there's more. Check it out.
I am Maddi Flanagan, and I am an ICU nurse currently in San Diego, California, but I was born and raised in Phoenix, Arizona, and that's where I got all of my nursing experience. And started on a tele floor there, and after a year and a half went over to CVICU, worked there for a little over 4 years, and now I've been in the MICU for 2 years.
Awesome. Okay, so what I want to know today is, what is your craziest nursing story?
So hard to think because I feel like over the years there's so many, but one that stands out to me the most, I would say, is back when I was in CVICU, we had a patient who came out on a balloon pump. Okay. The whole shift itself was from start to finish crazy. It was like I had this patient, they weren't doing well, went to cath lab, coded in cath lab, they came out with a balloon pump. Originally thought they were coming out with an Impella, so it was like mindset change. They were like, okay, we're doing this, and then they need the patient to go to a different hospital for some like very intense surgery, and they're like, okay, we're gonna like send them by ambulance. They like waited the whole shift. I was like, where's this ambulance? Like I'm waiting for them. They finally showed up, 6:30 p.m. Of course, it's like the end of the shift. I was exhausted. They were like, okay, I'm like giving them a report. I'm like, oh, like where's the like nurse like for the balloon pump? They're like, oh no, like someone has to come with us. And I was like, what? I'm like, well, who comes with you? They're like, oh, usually the bedside nurse. I was like, what the heck? So my charge is like talking with them. They're like, okay, yeah. They're like, can you go? And I was like, sure. So I ended up loading. We went with the patient. It took, an hour plus just to get the patient loaded in the rig. And at the time, the rig was like not the very large one. So you had to like break the balloon pump down into like the transport. Yeah. And so we get it loaded in, and little backstory, I get very motion sick. Like I do not do well in moving vehicles. So I was already like, okay, like going by myself. Yeah, I mean, only like ICU. And I was like, okay, I'm gonna be okay. We get loaded in. They like seat me sideways. There's a window in front of me, and I'm like, you see the like outside world. I'm like, okay, don't look out the window. I'm like staring at the patient. It was like a 45-minute drive. Whoa. And the patient was awake too. So like they're looking at me, I'm looking at them. I'm like, you're doing great. And then everything was great. Like we got him over to the hospital, and the patient ended up being great. And our doc had called the next day and was like, how'd everything turn out? It's all success. But yeah, that was my craziest story, I would say.
What a wild shift. Yeah, that's awesome. Thank you for sharing.
Thank you. Thanks for having me. It was fun.
This next story comes from Irene, who's been a nurse for almost 30 years. And she talks about how some of the craziest experiences she's had as a nurse has actually been psychiatric emergencies, and how they used to be so stressful, but now she's been a part of building a process that's improved patient outcomes and staff satisfaction, and how they respond collectively as a team to behavioral emergencies.
I've been a nurse since 1996, forever.
With a legend, all right.
And I got the opportunity to become the rounding nurse, which is the rapid response and the cold blue team and everything else. But I'm also in all different type of committees and stuff we do.
I love it, Irene. Okay, so the question I want to know today is, do you have any crazy nursing stories? What's one that really sticks out for you?
So we do have a lot of high population of patients that can be kind of combative. Staff was a little bit scared, nervous. We're trying to help with the staff. We developed this BEST program, and this BEST program came out really wonderful because what it does is it entails when staff has a combative patient, they will call overhead the BEST, and then we will have the physician there, security there, the rounding nurse there, house supervisory there. Everybody's on there. Everybody's taken care of. And I mean, these patients were able to de-escalate the situation quick and fast, and staff feels good. The patient, a lot of times, the patient just got to deal with a different face sometimes. Right. Just with the combative patients, you know when they're running around and back and forth trying to get them into the room and trying to de-escalate the situation. Yeah, it gets a little bit crazy. But before that, the staff was a little bit concerned. Now they're like, I'm okay, we got this.
Right.
We can do this.
There's a whole team coming together to support me and this patient.
Right.
I love it. Irene, thank you so much for the podcast.
Next, I met Teresa, who shares a moment where she felt really proud to be a nurse, proud to be a part of the profession.
I've been a nurse for 11 years, and I work in the ICU. I once was taking care of a patient in the ICU, and there was a gentleman who had multiple abdominal surgeries and had to have a colostomy, and was in there quite a long time, and his wife was in there with him most of the time. And after him finally getting out of the hospital, I ran into them, and she was telling people that I was the angel of his life, and that I made a difference in his life. And it just made me feel good to know that I made a difference in somebody's life.
Yeah, because you did. So much so that she actually remembered you all that time later.
Yeah.
They will always remember their nurse for that abdominal surgery, that experience.
I guess so. Yeah.
That's awesome. Those are the moments where, like, yes, you got to hold on to those whenever you have the challenging patients. Like, oh no, remember I got to be the angel in that family's life, right?
Right.
That's awesome.
So
Thanks
now I just want to be an angel in everybody else's life too.
love it. Thank you so much.
Next, meet James. James is a critical care nurse educator who has been giving his all to get his department back on track after COVID and to really build up his colleagues and prepare them for the challenging role of critical care nursing.
So my name is James. I've been a nurse now for about 6 years. Critical care has been 5 years of that. And so I recently became a critical care educator about 1.5 years ago.
Awesome.
My proudest moment so far is training and overhauling our entire unit post-pandemic. We've had tons of turnover, tons of travel staff that come and go, right? We have a lot of great travelers that do stay for a long time, but eventually they do have to leave us. And so now post-pandemic, we've been trying to overhaul our ICU with new staff. And so we've had to rely on various forms of staff, new grads coming in, med-surg tele-nurses transitioning over to critical care, getting critical care nurses with a few years of experience coming from different facilities. And so my proudest moment is taking these newer nurses or even nurses with no critical care knowledge and teaching them about pharmacology, advanced pathophysiology, advanced assessments, different types of skills, advanced devices, and seeing the learning and the light bulb just click for them. And seeing them take care of a patient on 15 different drips, when seeing them coming in for the first day to my unit and meeting them for the first time, they were afraid to even touch one drip.
Wow.
And so that is my inspiration. That's my calling, is to develop these nurses to be me one day. And to basically pay it forward to the people that paved the way for me.
James, that is such a good answer. I love it, and I know you feel proud watching them fly, but you'll never know like the patient impact that you've had. Like, not only are you helping the nurses that you've done or the patients in your career, but you're helping every patient that every nurse you train ever touches. Like, the impact is huge being an educator. So thank you for what you're doing, and thanks for sharing your proudest moment.
Definitely. Thank you.
Thank you.
Then I was able to snag the Nicole Kupchik. For any of you that work in critical care, everyone knows who Nicole Kupchik is. She is like the OG of critical care nurse educators. Definitely someone I've learned under for years and aspire to be like. So it was such a privilege to get to snag a quick interview with her and hear about one of her many, many proudest moments as a nurse.
Here with me, I have Nicole Kupchik, the legend in the house. So Nicole, I'm asking people today, first off, your name, okay, and then how long you been a nurse, what type of nursing are you doing these days?
Okay. Hi. So I've been a nurse for 31 years.
Yes!
Oh my God. I don't know how it's been 31 years. So right now I'm mostly running my company. I'm doing lots of education, but I do a lot of consulting as well as a clinical nurse specialist. And so I'll go into hospitals, kind of help them with different, improving different outcomes, like for delirium, cardiac arrest, sepsis, things like that. So,
awesome. So
super
still
fun.
impacting patients, but from an educator process change role.
Clinical nurse specialist process, from that aspect, advanced practice nurse. So yeah.
Awesome. Okay, so the question I have for you today is, thinking back over your career, is there any moment you just felt really proud to be a nurse? Like, proud of the work that we do?
Yeah, well, like so many moments. But like one of my favorite moments, I'm like big into pet therapy. Like, I just believe every unit should have a resident dog. That's just my opinion. But anyway, but I think just a kind of fun moment. Just like we had a patient that was dying, and she knew she was dying, and it was in critical care, and we were extubating, doing like basically extubating to comfort care, terminally. And anyway, so we smuggled in her dog and let her dog lay on her chest, while she took her last breath. And so I'm just a huge believer that pets can make a huge difference. And in the Seattle area, this is the coolest thing. So if anyone from Seattle is listening, you know what I'm talking about. There's a resident miniature donkey that goes around to all the hospitals in Seattle. And if you are having a bad day, when you see the donkey, you will no longer be having, you at least find a smile. So
I love it.
Yeah, so that's kind of one of my favorite things, just like pet therapy and just making things comfortable at the end of life.
Yeah, that is something you should be proud of. That is like the beautiful work we get to do as nurses, It's not just the clinical, get the right answer, do the right task, but like it's a human soul you got to care for and bring her dog in her last hours of life. That's beautiful. Thank you, Nicole.
And next, let me introduce you to Michael. So I actually met Michael last year at NTI when we both competed in the Critical Care Challenge. So my team took home second place and his team took home first place. And then I got to reconnect with him again as he was walking up to the stage to compete once again. And what do you know? Brother Man won first place again, 2 years in a row. So you have the privilege of hearing from the 2-time Critical Care Nurse Challenge winner, first place winner. It was such a pleasure to talk with another nurse who's just as passionate about educating and giving back to our profession as Michael is.
Sure. My name is Michael DeFrancisco. I'm a clinical nurse educator at Maine Medical Center in Portland, Maine, and I support the cardiac surgery ICU and the step-down cardiac surgery floor.
So all the gadgets.
All the gadgets, all the devices.
Awesome.
So I feel like as I entered my role as a clinical nurse educator, I've really been able to like help support and influence and like advocate for all of like the new people coming into critical care. And that's so important to me. I remember what it was like to be new. I remember what it was like to like not know what was going on and feel so scared to like ask questions. So now we have an Instagram page called Camp Competency, Camp_competency. So we have this onboarding curriculum to critical care. And we take on large cohorts of new grads into the ICUs, and it's all the specialties, neuro, medical, surgical, cardiac surgery, and we adopt the progressive care units as well. So we have groups of 30 people at a time, and we spend 3 weeks with them, but we turn it into this summer camp. So we make it's so much fun. So we focus on skill-based learning to make them feel more prepared to hit the bedside with the preceptor. So we're trying to like tackle preceptor burnout and like bridge the gap for like the transition to practice. So I am so proud about that. I actually presented on that last year at NTI.
That's awesome, Michael. You should be proud. You know, we always focus on like the person that's doing the CPR saved the life. How many lives have you got to save because of the nurses that are now equipped to handle whatever emergency?
It's amazing because I still I support a specialty, but when I see the people in the other specialties that I've like supported during Camp Competency, they still remember me. They come up, they give me a huge hug. They're like, "We miss you." Like, so it's so fantastic. It's
I love it. You should be proud.
Fills my cup.
All right, if you send me the link to it, I'll link it in the show notes.
I love that, Sarah. Thank you so much.
Thank you.
And then I had the privilege of meeting with Kali Dayton. We've talked several times online, but to actually get to meet her in person, her passion and compassion is just palpable. Kali is the host of the podcast Walking Home from the ICU, and she has done so much work to shift the culture around sedation and immobility in the ICU and to prevent and treat delirium. Can't wait for you to hear from her. Welcome, Kali Dayton.
I'm Kali Dayton. I'm a nurse practitioner. I don't know how to classify.
I was going to say, what really unique things that you're up to these days.
I'm training ICU teams to become awake and walking ICUs. So doing the full overhaul of education, knowledge, culture, practices, finding all the barriers that stop us from truly mastering the ABCF bundle. Yes, that's what I'm digging deep into. So I've learned so much more beyond nursing, but yet I feel like I've reconnected with nursing because of that, if that makes sense.
It is such important work that you're doing, and I am just so glad that this is the calling you've been given and that you stepped up for it. It's so important.
Thank you.
So the question I'm asking you today is, tell me about a time that you were most proud to be a nurse.
So I don't know if I really had the pride that it warranted while I was doing it. So when I was a nurse, bedside RN, in an awake and walking ICU, I was so brainwashed to think that it was absolutely normal to keep patients awake and oftentimes they're walking on the ventilator. They were awake right after intubation, to get up right away. So it was so standard of the conveyor belt, that I didn't know anything else. I thought that was normal. And I loved it. The way that I was able to humanize care, I know what patients loved, wanted, needed. I have moments where end of life was beautiful. Even if they weren't going to survive, I knew I gave them the best chance. But I didn't understand the impact of what I was doing, if that makes sense. I just knew that it was why I wanted to connect with patients and see them successfully walk out the doors. And then I became a travel nurse and I went elsewhere, and it was a huge contrast for me. So I still didn't have the tools to really look back on what I'd done there and was so proud. I went back to that first ICU nurse practitioner, And I saw what they were doing and I realized the contrast. And as I started digging into the research, that's when I actually realized how much of an impact I was making on survival and patients' ability to return to their lives afterwards. Yeah. And I remember during this phase of being in grad school and back in my home ICU, trying to figure out why it was so different there and all the things, learning about the research, what drove it home and what made me the most proud of that kind of nursing was when I was in a hospital cafeteria and someone yelled across the cafeteria, "Hey, I know you." And I turned around and I was like, "Are you talking to me? Who is it?" And it was this person that looked so familiar and I couldn't put my finger on it. She had some distinct features, like some missing fingers and certain things that it started to come back to me and she said, "Oh, you were my nurse when I was in the ICU." And I was like, "Oh," I thought I hated you. And I was like, "Oh." And then she said, "You made me walk." And I was scared and tired and thought I was going to die. And I was just then I had flashbacks to the ICU room and she was very anxious at the baseline. And she was very sick. She had trach and peg all over her. And we pushed her to get up and move. She was in a motorized scooter at baseline. So we were making her stand up while she had severe pneumonia. You know what I mean? So I was looking back at that and I was realizing, she's not wrong. And I was about to try to explain myself when suddenly she interrupted my thoughts. She said, "But because of you, I went home and you saved my life and I've loved you ever since." And I realized that this little lady had me in a bear hug. And that, I don't know how to explain, where at that point, I think I'd been in critical care for 7 or 8 years. It was that moment where it really came together. Yeah. Those decisions, those interactions that I had, pushing someone to walk and to mobilize when they wanted to stay in bed, it really did save her life. I remember talking to her and she would write on the clipboard, "I don't want to go into a nursing home." So we would use that to say, "Then you gotta get up." Right. And she recognized in retrospect that saved her life, and it really did. So when I look at,
and you recognize in retrospect that it saved her life, right?
Yes.
You're like, "Oh yes, that was important work that I was doing."
Yes. But that day that I was with her, did I walk away and be like, "I'm a bad egg, saved her life"? No. It was just another day. I didn't realize it. So it's now looking back that made me so proud to be a nurse. And now working with nurses to revolutionize our culture and practices that we've held for decades, watching nurses be so emboldened and compassionate and powerful and push against the system, and the opposition they go up against is incredible. They put their relationships with their colleagues on the line. They're daring to do things that they've never done. Art of the evidence, but most of all, with so much compassion and vision. That has made me so proud to be considered a nurse amongst these kind of nurses. So watching nurses do their thing makes me realize the power that I have as a nurse and a nurse practitioner to truly save and preserve lives.
Save and preserve lives. I love that. I love that phrase. So, Haley, whenever I hear that story, I think about the phrase I like to tell all the time is remember to look past the task of nursing and see the human soul you're caring for. I feel like you did that for that patient. Like, she didn't want to do the task, but you're like, no, as a human, I care for you so much that I want to push you to get out of here, to be able to go home to your family. And you did. I know it's hard. I'm sure it was hard. Yeah. It's not easy to motivate people that don't want to do the thing. And now look at her. Now she's forever grateful, forever changed. And you said she was standing to give you a big bear hug?
Yeah, she was using a walker. So I don't know, it's definitely changed the trajectory of my life. And at that time, I had been a travel nurse yet. I had seen the outside world. I just knew that most patients there didn't go to nursing homes, and that was our personal failure. I knew that at least. But at the time, now that I had been elsewhere in 11 other ICUs throughout the country, and I seen what happens when you don't get out of bed, I look back and I'm like, "Oh, Haley, you didn't realize what you were doing in that moment," and that I did that for so many patients. And so as a nurse, you oftentimes don't realize the repercussions of those actions, but the power that nurses have to, again, change the trajectories in these lives, whether or not to determine whether or not to sedate a patient, how deeply to sedate them, whether or not to mobilize them. And when I see nurses make those changes, again, it's rooted not in the healthcare savings that it provides, not only to stay, but it's because nurses deeply care about their patients. and you see the true heart and grit of nurses when it comes to rolling out the bundle.
Yeah, I love it. And that's the profession we get to be proud to be a part of.
Isn't it amazing? I just feel like I'm a nobody amongst heroes. So thank you.
Thank you, Kaylee. Pleasure talking to you today.
Appreciate it.
I also got to meet Adriana, who shares a story not of an amazing save that she was a part of, but rather special memories that she got to be a part of for a patient who she cared so much for, but also the impact that she made on the patient's family. You know, we all go to nursing to care for the sick, but we get to do so much caring also for the patient's loved ones. So I love this story that Adriana shares. Listen in.
My name is Adriana. I'm an ICU nurse. I've been an ICU nurse for more than 10 years.
That's awesome. All right. So the question I have for you today is, when you think over your career, what makes it all worth it?
When people are grateful. And as we were talking, I remembered a story. I had a young man during COVID. He wasn't going to make it. We were about to put him on ECMO. And me and my friend worked so hard. But we work hard without thinking about it, very thoughtless.
Yeah.
You know, we try to save him, and then he ended up getting transferred to another unit. And a couple of days later, the parents came. They were looking for me and my friend. Actually, the dad said, come. I want you to meet my wife, because I want to show my wife the people that were trying to save my son. And we were like, oh my God, because we didn't think like he would remember us.
Yeah.
And 2 days later, he came and he said, you guys are awesome.
Yeah.
Keep doing what you're doing. And that's the strength that we find in this career that is very, very tough.
Yeah.
And not a lot of people like go through it, you know. So that's my 2 cents.
Yes, I mean, that's the profession I'm proud to be a part of, is the nurses that work hard to save someone's son. Like, for us, there's not a task, you know, but the beauty of you got to be with that family, and they got to watch someone work hard to save their son.
Some of them don't remember us, but the ones that do, they come and they say, you know, you worked really, really hard, and we thank you.
Yes.
We thank you.
Yeah.
So
makes you proud to be a nurse, huh?
Yeah.
All right, thank you so much.
Oh, thank you.
That's it.
It was great.
And last, but certainly not least, when NTI was all over and we were breaking down our expo booth, I finally got to stand with my friend Nick for a quick interview where he talks about the opportunity we have as nurses to care for people when they're at their most vulnerable state. I love the story that Nick shares because it so beautifully exemplifies the important role that we play as nurses in providing dignity to our patients, no matter where they come from, no matter what their background is. We get to care for them and provide compassion on possibly the worst day of their life. What a privilege it is to be a nurse. So listen into Nick's story.
Well, Nick, friend, welcome to the Rapid Response Run podcast once again.
Thank you.
So, Nick, when you think back over your career, are there any patients or times you got to provide care that are very memorable, that just have still stuck with you?
Oh man, there's a lot. There's a recent patient that I had about 2 months ago that I'll never forget. And the experience of this patient and taking care of them, and it even changed a little bit of me in how I perceive patients and then how I just perceive people in general. So patient had been in the ICU, found alone in their car, septic, I think was the story. Pneumonia, that's what it was. On a high flow, I think it was like 60%. So anyhow, you try to paint the picture of the patho with this patient. And I'm getting report on the patient from top to bottom from the night shift. Okay, cool, give me the ABCs, give me the rundown from head to toe. And the last bit of the report was after we went from the full, head to toe on all the assessments and the SBAR, was, oh yeah, and by the way, Nick, the patient is transgender. We're born a man, and now they're female. And the patient's about 65 years old or so. And so there was that. And that was the last thing that was popping before I went into the room. So it kind of initially threw me for a loop. And I thought, oh man, in the back of my mind, I thought, here we go. This is going to be an interesting shift. And I had this whole picture in my mind of how this shift was going to go. And I had an unconscious bias of what I was going to encounter with this patient. And how do I treat this patient? And what if I mess up? And what if it goes to my boss? And all the things that are happening right now in healthcare and in politics. And I don't want to mess up. I just want to do my job, and I want to take care of this patient because that's what I'm here to do. And so, but I want to do right. So I was expecting this patient to be very, I have my rights, and you'll address me the way I want to be addressed. And I just had this preconceived notion, and I was expecting problems. But what I got was very different. This patient was, for lack of a better word, this patient was in despair. I'll never forget the look in this patient's eyes. I'll never forget how they felt. They were in such need of just compassion. They never asked anything from me. But every time I did whatever I could do, it was just, they could barely breathe. They were on high flow, horrible pneumonia, could barely mutter, but any word that she muttered was thank you the whole time. And it made me want to give more. Is there anything else I can do for you? And I remember the dignity part of it. She was wearing a wig. And I was very careful not to move, not to expose anything the whole time. If I needed to assess, I got another nurse, a female nurse, because I asked, is that what you would like? And so it kind of broke me down by the end of the shift. And I just thought this was a human being, is what it was at the end of the day to me. And I'll never forget that. And so it helped me check my unconscious bias as a nurse, that there's just people out there having a human experience, and this is a human being that just needs care. And I'll never forget that. And it made me want to do more. What can I do for you? Is there anything else? Are you sure? And yeah, that was an experience I'll never forget. And so moving forward, how I carry my thoughts and my biases or my preconceived notions and how it all intertwines with my care of patients. We're all just human, and we're having a human experience, and we're all deserving of compassion, and as nurses, providing the best possible care we can give. And that was my experience.
Yeah, I mean, as nurses, we get the opportunity and the privilege to care for someone in their most vulnerable state. And I can't actually imagine how vulnerable it must feel to be someone who's transgender and to have to go through the experience of having a medical emergency and being a patient. And I love that you were so sensitive to that. I can hear the shift in you where at first you were like, what if I do something wrong? And your shift was, what can I do right? What can I do for this human, this soul that I get to care for? Rather than initially like, oh no, all the fears that come up, all the biases. Once you actually met the human soul, all that kind of melted away, and you just got to be a human that's caring for another human, providing dignity. It really, I don't know, to me that's the beautiful side of humanity, and especially of nursing. What a privilege. Thank you for sharing that story, Nick.
Absolutely.
And that's a wrap. I had such a blast at NTI. I've said it before and I'll say it again. For me, the best part of NTI, even though I love education, the best part is the camaraderie. With literally thousands of nurses from across the country, getting to meet with them, I hear their stories, see what it's like to work as a nurse in other places. We all have so much in common, and it's just beautiful. It's such a joy to meet with all of you and to do these little mini interviews. So I hope that you found joy in it as well, to hear from other nurses' perspectives, why they love being a nurse, their crazy stories, their heartwarming stories, what they're proud of. This is the profession that we are so proud to be a part of. So if you haven't been to NTI, I hope you will join me next year in New Orleans for NTI 2025. Before you go, I have an exciting announcement. You can now earn CEs for listening to this podcast. That's right. Our Renegade has teamed up with podcast hosts like me who are delivering amazing content that not only educates, but inspires you to be the best for your patients. You get to learn and earn continuing education credits while absorbing knowledge from thought leaders and innovators in the field of health and medicine. You're already listening to podcasts during your commute, at the gym, or while unwinding after a long day. So why not earn your CEs at the same time? And that's where pod classes come in. Yep, it's just what it sounds like. It's CE learning through podcast. To learn more, I put a link in the show notes for you. Well, thanks for listening. I hope you learned something that will save a life. Remember, nursing is a team sport, so trust your intuition and don't give up advocating until you are confident you've done what's right by your patient. The views and opinions expressed on this show are that of Sarah Lorenzini's. That's me and mine alone. They are not intended as medical advice and should not take the place of your institution's policies or procedures. Evidence-based practice is ever-changing, and your patient care should reflect the current best practice. So if you want to get in contact with me, you can shoot me an email at sarah@rapidresponsern.com or on all social media platforms as the Rapid Response RN.